Well, thanks very much, Eugenia, for coming along to have a chat about how you see the development of clinical commissioning in the borough. So I just wondered if you might begin by giving an overview as to where you're at this point in time.
Thank you very much, John, for this opportunity. Absolutely delighted to be here to talk about how NHS Greenwich Clinical Commissioning Group had been. We've been established as a shadow body since 2011, and in the meantime, GP executive like myself, I work locally in Thamesmead as a GP. I was here just before this meeting, home visiting one of my elderly patients, and it really brings to mind why clinical commissioning is such a fundamental change from what it had been before, that clinicians like myself can influence decisions on how do we provide healthcare in our borough, and actually translating some of the health needs of our patients into services that really would benefit them. So for example, just before I came, my elderly patient whom I've known for 5-6 years and are coping okay but just struggling a little bit, and his equally elderly wife, who's been his amazing carer for the last 4 or 5 years, and her health is getting a bit affected as well. And the fact that we've got a joint emergency team in our borough, which is a nationally award-winning team, where social and health join together so that we can provide community health care to one single patient and wrap the team around them is so important. And the fact that I can phone them up and explain to them, this is what's happening, and on a Tuesday afternoon I can set up service like that so that my patient who doesn't want to go to hospital, but without that service would have ended up sitting in A&E for 4 or 5 hours just because the social situation isn't allowing them to be careful at home. But having that organisation set up already with a team who knows my patient, are ready to, and able to provide care, have been such a phenomenal change.
So in general terms, the relationship that is developing between social care and health, do you think that's going to have an important impact on patients, young and old?
Absolutely. I think we have such shared interests in the population that we serve that a lot of the work, every single part of what the council does have an impact on the health of my patient, whether this is housing, whether this is education, whether this is licensing, whether this is adult social services or children's social services. Every single part of the remit of what the borough does impact on the health of my patient, and actually having that dialogue, and now I'm beginning to understand so much more of what the borough provides than I did 2 years ago, really helped to aid that conversation. If my patients talk about benefits, I don't just tell them, go and turn on a job centre. I know who to direct them to, and all that impacts on the health and well-being of our population. That can only be a good thing.
So are you likely to, would you be happier if you had fewer patients coming to see you because they were much healthier in their lifestyles? And what do you think people need to do for themselves to improve their health?
It is my utmost passion to make sure that my patients can live as healthy a life for as long as possible. So I'm there if they need me, but if they don't need to see me, I will also be delighted, because that tells me they are fine and they're getting on well in their lives. And the vision that we have is actually improving our population from the young to the old, so that our joint strategic needs assessment really reflect that, where we have part looking at children, maternity, so literally from cradle to grave to end of life, where do we need to focus on, and having that joint assessment really help us to look at all the social determinant of health, so things that people can do to help their lives to be healthier for longer would be things that we've always been talking about: the smoking cessation, the physical activity, able to take time out, enjoy their lives with their family and friends, which the borough is doing great with all the leisure activities, all the regeneration, and Greenwich is such a better place to live, and the riverside have really been transformed. so that Thamesmead in our area, we are really benefiting from all the work the council's done.
And you and I have been involved in the Health and Wellbeing Partnership and engaging with partners about developing service and improving them. And as a male, I've been very interested in Men's Health Fortnight,
Yes, yeah.
which is having an enormous impact. Do you see initiatives like that as getting key messages across?
Yes, men's health has something that Greenwich had always been trying to grapple with, because we have a historic health inequality in particular with our men. That's men who are living in the most deprived ward in our borough live on average 7.5 years less than the men who are living in our least deprived ward. And as a borough, we've been really working hard to correct some of those social determinants, and men's health in particular, we've been really working hard on with our public health colleagues, targeting areas which are particularly challenging. So we're working with voluntary sector, we're going to where the men are, so we're working with Charlton Athletic Football Club, we're working with our mosques, we're working with the temples, so that we can mobilise our community leaders. And that trend, I'm really pleased to say, is beginning to turn, just so that we can really look after the men, the women and the children of our borough well.
But women, I think, tend to be more concerned about their health, where we males are a bit wimpish, aren't we, in terms of not wanting to know.
Hopefully you'll be surrounded by women who would be nudging you to get your NHS health checks done, and say, if you haven't had it yet, make sure you do.
So in conclusion, do you see a situation whereby we're moving forward, obviously, in terms of improving residents' health? What do you think the priorities are likely to be for the next couple of years?
For the next couple of years, what we want to continue to really build on is to improve and reduce our health inequality in our borough, just so that we can lift up the population health across the borough, which we have been working on, but also we need to be improving. And secondly, one of the challenges in our patch, and I'm sure as you know, is the Trust Special Administration, and going through one of the first historical administration on our doorstep is going to be an opportunity, but also a challenge to make sure that healthcare provision is sustained in a quality, accessible service, which we're absolutely committed to. So in the meantime, we want to make sure that our residents, our patients are able to access the care that they need in community when possible and in hospital when necessary.
Great, thanks very much.
No problem.